So, on an MRI, I have marked arthritis in my hip, but man, it's not the problem. I mean, I'm convinced that it's my lumbar plexus, among other things, but I'm just intrigued to see what the injections that you're doing, if that could help me.
Okay. So I mean, the first step for me is good history and physical in order for me to see why I think you're having this hip pain. We can have pain on the front side of the hip due to many different reasons. Obviously, this can be a hip pathology. This could be some ligament laxity in the hip. This could be osteoarthritis. You could have fat pad impingement on the anterior aspect of the hip. You could have some greater trochanteric pain syndrome, or better termed, some gluteal tendinopathy. All those can refer to the front side. Obviously, anything in the pubic symphysis region can refer over to the anterior aspect of the hip. You've then got the nerves, right? Which those nerves are going to come from the lumbar plexus. We've had a few patients who have had a true lumbar plexopathy where, we've actually done a lumbar plexus hydrodissection in the psoas muscle to help with the pain on the front side of their thigh and kind of in the anterior hip region. But we can also have pain that refers from the back over to the anterior aspect of the hip. So sacroiliac joint is probably more common. Sometimes the cluneals will go to the anterior aspect of the hip. Had that maybe 3 or 4 times, but definitely, the cutaneous branch of subcostal nerve, the lateral branch of iliohypogastric nerve can go to that front side of the hip a little bit. So a lot of different reasons why you might be having some anterior hip pain. All those things that I just listed off are all things that I can treat with injections. And so, as long as, you're not at the stage where you truly need a hip replacement, then the injections that I do may be beneficial. But first step is physical exam, assessment, figure out why I think you're having this issue.